Welcome. Thank you for joining us today. My name is Sean Evans. I'm with the Meridian Chamber of Commerce, and the Meridian Chamber of Commerce, in partnership with the City of Meridian, Central District Health, Crush the Curve Idaho, and numerous partner organizations and individuals, are proud to share with you a program that will assist Meridian businesses and organizations as they reopen for business. Our campaign is designed to educate the businesses on the basic guidelines to reopen based on Central District Health and CDC guidelines. It will allow businesses to demonstrate to the public what they're doing, so what they're doing that will keep Meridian healthy and open for business. Online and speaking with us today are just a few of the partner organizations that have helped develop this program and support the Meridian business community, as well as local businesses and organizations leading in best practices when it comes to safely reopening. Today, we have Matt McDonald, Program Manager with Central District Health, as well as Tina Upton with Crush the Curve Idaho that will be talking about testing availability. Also with us today is Eric Exline, the Chief Communications Officer with West Ada School District, to talk a little bit about what the schools are doing as they're looking at reopening and best practices that they're taking to keep everyone safe and healthy. We will open it up for questions at the end of the presentation. You can enter your questions anytime during the presentation in the question window. With that, I'd like to talk a little bit about the premise behind our campaign as we're getting businesses open and restarting our economy, and why this group was started. We initially pursued efforts to get everyone open as early as possible, but we saw the bigger issue of businesses that will face when reopening amidst the COVID-19 crisis. And that was, will the public return to the stores, establishments, and organizations when they reopen? We're contacted daily by our business members on how the governor's plan applies to their business or organization. When can I actually open? And what guidelines does my business need to follow? While the Meridian Chamber of Commerce is not an authority on this plan or the recommended guidelines, we are here to help the Meridian businesses and organizations understand them better. The last thing we want to happen is for our local businesses is that they go to the effort and expense to open, bring back employees, restock their shelves, and the public, the consumers, not visit their establishments out of the fear or concern for their safety. The Central District Health and CDC have developed some guidelines to reduce your risk when out in public. And if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public safety and health, then that will build consumer confidence necessary to restart our economy. Meridian Chamber of Commerce has launched the Keep Meridian Healthy and Open for Business campaign to help our businesses build that consumer confidence. As businesses open according to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses and organizations by conducting industry-specific webinars like this one that will provide information from Central District Health on basic guidelines for that industry. Also, the webinars will feature local business leaders and organizations that have taken even further steps to ensure that they are reopening in a safe and responsible way. After businesses or organizations participate in the webinar for their industry, they'll be provided free of charge collateral material that they can display in their store that recognizes them as participating in the Keep Meridian Healthy and Open for Business campaign. This material includes door signage that shows and demonstrates to people before they even enter their store or business that they're part of the campaign. We also provide signage, posters that they can display in the store that just demonstrates the things that they're doing to follow the Central District guidelines to create a safe and healthy environment. We also have social media materials that you can push out to your followers and social media platforms so that you show to them that you are being serious about their health and participating in this program. Inclusion on our website and part of our marketing campaign for all participating businesses is also included. Our program goes beyond what other communities are doing. We're trying to help the businesses understand the guidelines out there, and not one size fits all solution is for every business. We don't know what we don't know. These industry-specific webinars seek to educate beyond a sheet of written guidelines. That is the true value and safety for employees and customers. To be in compliance with the governor's 4-stage plan, though, businesses will only be provided this collateral material when their business is scheduled to open according to that plan. We do have a lot of different webinar, industry-specific webinars, like you see here on the screen. This week we've got 3 webinars. Next week we've got 3 more based on ones that we have coming up in the different stages. We also have numerous webinars already posted to our website that we have conducted in the last 2 weeks. So visit keepmeridianhealthy.org and see those webinars and see links to other valuable information from Central District Health and the CDC. Also, please fill out the survey after you participate. This will assist us in phase 2 of our program as we build out business revitalization teams to support the Meridian businesses. With that, I'd like to turn it over to Matt McDonald with Central District Health to share some basic guidelines for the industry that we're talking about today. That's preschools, daycares, and educational facilities. Matt?
Thank you for having me. I would like to say a lot of these guidelines I'm going to go over, I have noticed that a lot of the facilities are already implementing them, so it's very encouraging to see. But here we go. So clear communication plan needs to be created between the parents, the children, and staff. They need to inform and encourage preventive measures. Another recommendation would be modify drop-off and pickup times. An example of that would be curbside pickup, maybe stagger drop-off and pickup times as well. Temp checks at the door with an infrared thermometer. I've seen that being implemented a lot, and that can be very, very useful. If one's not already in place, we recommend an illness policy that addresses the coronavirus, and also have a process for identifying and sending home children and staff that are exhibiting symptoms. A designated sick room is ideal to keep the sick children and/or staff away from the other people at the center. Limit group sizes to encourage physical space between children. Limit item sharing. More outside time when you can. Keep windows open when you can. Stagger meal times so we're not all getting together at one time and eating. Maybe do meals inside the classroom. Increase frequency of cleaning, sanitizing, and disinfecting, especially the high traffic areas, door handles, knobs, light switches, furniture, handrails, sinks, drinking fountains, bathrooms. Remove materials out of the location that are difficult to clean, like soft toys and porous materials. Also, we already do this, but encourage thorough hand washing. Use respiratory etiquette. Also, the ICCP has developed a handbook, and there's some additional things in there I just want to point out real quick. They recommend an on-site safety officer for mental and physical health, an on-site nurse, an on-site infection control for cleaning and disinfecting, and just have a daily checklist to make sure you're getting everything done that you need to get done. One other thing I would like to discuss, kind of how we react to it. Any child or employee being tested should not be in the facility. If the negative test is done or it's not done, that child or employee needs to stay home till the fever is gone or they've been symptom-free or improved symptoms for 3 days. If there's a confirmed case, dismiss students and most staff for 2 to 5 days. Clean and disinfect thoroughly, and work with health officials to determine next steps. And then clearly communicate this with staff and parents as well. If there's a potential exposure, of course, we need you to quarantine at home for 14 days. And as far as reporting COVID-19, if any of the staff or family member are exposed, call 211 and notify health and welfare with any changes in business practices. So that's pretty much sums it up.
Sorry, I think we lost Sean for just one moment. I think he'll be right back with us.
All right, there we go. Matt, thank you so much. I appreciate you offering that. Your website has a lot of great information. We link to that. Others can find that. Thank you for sharing. If you would mind staying on the line, and that way we can, if we have any questions that pertain to the Central District Health, we'd appreciate that.
Sure.
All right. While it's not required at this time for employees to return to work, one of the most important factors that's been outlined all along is the importance of testing and tracing to slow the spread of the virus. Joining us today to talk about the availability of testing in the Treasure Valley is Tina Upton, with Crush the Curve, Idaho. Tina? There you go.
Hey there. So just kind of take a few minutes here. Thank you so much. I'm really excited for the work that the Chamber has done, the City of Meridian has done to be proactive and really set a really great template that can be followed by other organizations and groups, and a lot of hard work's gone in. So really grateful to be able to be partnered with your local chamber, and appreciate all the things they've done. In talking about testing, a couple of things just from, getting everybody on the same page perspective. Crush the Curve was founded a whole 4.5 weeks ago or so, and really just said, hey, by a bunch of business leaders from around the state that came together and just said, hey, what could we do to help? We've got resources, we've got our networks, what could we do to help facilitate Idaho from a reopening perspective, and then a staying open in the fall. And this is a really important topic for us today, talking with school facilities. One of the things that from the time that I came on board and that we still talk about is we have a countdown to the back to school date. That's actually the date that we track against. As from the time I got brought on wasn't all about what could we do today, but it was like, how do we keep our eyes on that date and make Idaho be able to be as safe as possible for lives and livelihood come the fall, when we know that symptoms that are COVID-like that happen with the flu and strep throat and other normal common colds are going to, cause us to need testing, and then have that awareness, and then be able to implement quickly protocols and within schools, which is going to be a very difficult environment to do a traditional, social distancing or whatever that protocol could potentially look like otherwise. So it's been a really important topic for us, and I'm excited to be here. In talking about testing availability, we don't have a shortage of test kits as we saw, a couple months ago, even as early as 4 or 5 weeks ago, in regards to the active virus. Meaning, if I'm symptomatic, I believe I'm sick, and I need to be, swabbed to check for the virus here in the Treasure Valley, you can get that done. And so one of the things that we do is on our Crush the Curve website, you're able to check in those symptoms, and it'll tell you areas or different locations here in the Treasure Valley that you can go to because you're not feeling well, that will test you for active virus. There's the PCR test that we're talking about here is the one that checks just for that. So this is the nasal swab. I know we've heard of it. This is the one when everybody said testing, there aren't tests available, there aren't testing kits available. This was the test they were talking about. We are seeing with corporate reopening, individuals opting into having groups of or all employees tested upon reopening. And so they're testing both symptomatic, or not just symptomatic, like I talked about, which everyone symptomatic should get tested, but they're testing the non-symptomatic. That's an option to see if you have the virus upon reopening within your place of business, and then allow you to make decisions off of it. And so it's kind of just up to everybody on how they want to do that. But we have seen some corporations, especially those in which their workers are going to be in close contact with each other. The doors have been closed for a long time. I call it, almost 90 days. Like, they just don't want to start off with an active virus in the building. So we've seen that kind of testing happening. As far as results and responses, I know Matt just talked about this too. We're just constantly trying to stay as lockstep as we can with the CDC recommendations on what to do if I believe I'm sick and now I get tested. Should I be self-quarantined until I get results? Once I get the results, based on the results, what are those next recommendations to have there? And we've been putting in a lot of time and resources on the educational components like that. And again, our goal is to say, by back to school, we want to be able to have that collateral. We want to be able to have it at a level in which the community understands really clearly what to do. We talk about it internally and say, we all know what to do when we catch on fire, and that's to stop, drop, and roll. But we can't really get a straight answer from anybody on what to do if I wake up with a sore throat and a fever. We kind of have a good idea, but what does that look like when the test comes back negative? Do I still go to school and teach? The answer is no, but I need to understand when I do, right? And everyone needs to understand that at that basic level. So we're investing a lot of the donations that our 501c3 has received into the education collateral to empower parents, students, teachers, anybody in the community to be able to engage with collateral that can bring it down to that most basic level. So I'm excited about that. Moving on to the other kind of tests that we've been doing a lot of mass testing here in the Valley, so I think it's gotten some attention, is the antibody testing. And this is not testing that tells us or will tell you if you currently have COVID, but it'll tell you if you did have it. And that's the point of it. This is a really good data point. This is not something that means you're letting somebody know that they have immunity and that they should now disregard safe hygiene or social distancing protocols. But it's really important data point for us to be able to be gathering, especially moving forward, to understand at what level a community's been exposed, be able to study antibodies at all, to be able to understand they were here and then somebody got sick again, right? And what does that mean? So, just as another type of test, but it's one that gets a lot of attention. This one's a blood draw and is sent to the University of Washington at this time, and that's where they do the actual testing. This isn't one of the things when you hear about testing shortages. It's not this test that we're talking about. What's my next slide? I apologize. Great. So employee testing. This is kind of the conversation of one or both tests. When do you want to be, tested? What should cost planning look like for that? What should those protocols look like? Another thing that we've seen in regards to schools yesterday, Wilder School District, for example, we secured enough Kinza thermometers, which is a smart thermometer for every home in Idaho. And Wilder School District implemented getting those for all of their families, or all the homes of their students, right? So it's just another data point. It's something that would be helpful to see across the. It doesn't speak at the individual level, but it would speak at the school district level that there's been fevers within the school district, right? And it could help maybe a school make an educated decision, a community even make an educated decision. Could help us inform us that we need to do some spot testing of, stand up some testing tents and do some mass testing and get individuals in quickly to identify if COVID is the reason for the spike in fever. So that's one thing that we're seeing implemented at the school level that is going to be really helpful for us to understand when to test and when to check in with that and how to run that. So, we're constantly working on, again, the collateral for testing protocols and helping that be just lockstep with what's coming from the CDC, but then also communicating with everybody in a way that meets them where they're at, so they understand what step they need to take, what their options are. And then as an employer, on the employer side, a cost planning, right? Like who pays for this? What does this look like? We start following the protocols from the CDC that in regards to self-quarantining in these cases and waiting this many days, which means we have staff that aren't working, right? And what does that look like? And what does that mean for my business? And these brings up a whole nother slew of questions. And so we're not callous to that. We're trying to navigate that and help empower with as much information as we can, and just kind of get that planning and understanding and looking forward on what the testing protocols should look like.
Thank you, Tina. Appreciate you sharing and keeping us up to date on the good work that your group is doing. Businesses and organizations here in Meridian are very creative. They're coming up with great ideas. They're coming up with best practices that they're willing to share. And definitely daycares, childcare facilities, and educational facilities is one of the concerns that a lot of people have. And they'd love to hear about what's going on. With us next, we have Eric Exline, the Chief Communications Officer of West Ada School District, to share with us some of the best practices that they are putting in place with their school district, maybe their administration offices, and what it looks like for their teachers and employees going forward. Eric?
Thanks, Sean, and thanks to Matt, too. Central District Health has been an incredible resource to us. I think the head of our health services program has contacted them nearly daily throughout this and our planning and preparing. So, as a school district, we started developing a pandemic plan quite a bit before you started to see cases of COVID appear. You knew it was coming, and then you started to have community spread. And so on March 13th, we closed our schools, and then ultimately the state board issued a statewide closure. which puts schools in a little bit different position than just a general stay-at-home order, because it was a soft closure, which meant we could continue business for the purpose of providing remote learning. It was a fast pivot to go from kids in classrooms to delivering education remotely. And we did it in about 3 weeks. Wish it could have been faster, and I'll talk a little bit about next fall and what we're thinking about will happen there. And at the same time, like every other organization, we also had to implement plans for remote work at our office, so that functions like payroll and accounts payable and IT services and communications and on would continue. I would tell you that that worked extremely well. We found that our IT staff could work remotely. You could track their efficiency. They were very efficient. You could see we staggered how our employees came in accounts payable and payroll to provide physical distancing. They are able to continue to get their work done kind of across our organization. We still don't have nearly all of our staff in our building, but all the work is getting done. So let me talk a little bit about what we're thinking about what's going to happen for the start of school. I heard Dr. Fauci say yesterday that schools shouldn't open for a year, and I need to tell you that they need to. Kids need to be up to date on their education. They need to be prepared for life after school. And so we have to figure out a way to make that work safely, which I think we can, and also effectively from an educational standpoint. So we've kind of broken it down into a few scenarios because no one knows for sure what next fall is going to look like. So happy scenario number one, everything's normal. We all go back to school. Maybe that's not a high percentage opportunity. Scenario number two, there's still some community spread, and we need to implement a lot of the things that Matt talked about. Physical distancing, all the hygiene protocols, health checks, how you manage the flow of students in a building. All of those pieces have to be in place to make school both safe and effective. I would tell you that in some ways, school districts have a big advantage. We have nurses on staff. We have an awesome custodial staff that clean our buildings top to bottom, day and night. So those pieces aren't so hard. Physical distancing is the biggest challenge. So if you think about one of our big high schools, Rocky Mountain, pick one, more than 2,000 kids, right? And if you've ever been in the hallways, no one's very physically distant. So we're being really creative about how we can deliver educational services that are valuable and effective for kids and still keep everybody safe. And what that probably looks like is a blended system of in-school education as well as online education. And I think it's important to get to the effectiveness of the online education is that it's going to have to be delivered in contact with a certified teacher. And I think we can do that. Again, it's going to take a lot of work over the summer. It's going to take some pretty significant investment of resources to get all the computers we need because we don't quite have enough to do a one-to-one delivery system. We're looking at different kind of scheduling, different kind of bell schedules. You know, Matt talked about some of the real minute details. You know, you get school principals together and they're talking about, well, maybe you don't use lockers anymore because that creates congregations of kids. How are we going to make lunch work and have physical distancing? And I think those plans are coming together pretty well, and they will be doable, and we will have a successful fall. But we are determined that we're going to come back to school next fall, and we're going to educate the kids in West Ada.
Excellent. Eric, thank you very much for sharing. Let's see here if we've got any questions from our attendees. Remember, you can enter your questions in the chat box, and we'll get to those. Okay, Eric, is there different guidance for elementary schools and the time frame that those students would be attending? I think we have some, you know, the concerns from the business community come back to those younger students and the time? How is that going to impact parents that need to work? You know, as the students get older and can stay at home, there's maybe not as concerned, but the younger students, is the school district thinking about those thoughts?
We are. In fact, we talked about this very topic yesterday. The guidance isn't different. The challenge is probably a little less because there just aren't the numbers of kids in an elementary school as there are in a high school. You know, our elementary schools have 650 kids. The challenge is still, however, if you have 30 kids in a classroom, it's very hard to achieve 6 feet of separation. So we are having to look again at how that schedule is going to work, and at the same time be cognizant of the fact that daycare is a real issue for parents. I can't tell you we have it 100% figured out, but we will before school starts out. But we do have to factor all those things in. As long as physical distancing is in place, we have to have a system that delivers it so the kids are safe, the teachers are safe. You know, and we have particular other things that we have to think about. If you have staff members who have underlying conditions and it's a problem for them to work, and we have students that are the same, and we've identified them, like 8,000 students who have a health condition that puts them at higher risk if they contract COVID-19. So then we have to have individual plans for those kids to make sure they're safe. But we are definitely aware of the fact that, say, this spring, it's been a new challenge for families that they were working, or maybe unfortunately they weren't, and their kids weren't in school. That's a lot for families to take on.
Okay. Eric, another question for you maybe is, with the blended model that you had discussed, how are schools approaching the internet connectivity for all students?
That's a really good question. We did a survey of we actually called all our kids. It wasn't really a survey. We called them and had specific questions that we asked to identify what percentage of our families didn't have internet access via computer. And we found it ran about 10%. So what we did for this year is then we provided computers at the middle and high school levels for those kids. And we also provided internet hotspots. So these are a device, it's essentially like a cell phone subscription that we provided to families who didn't have that access. Again, all these things don't come without resources. That's about a $40 a month cost. It's essentially like signing up for a cell phone. But that's how we met that challenge for this school year. That will continue to be a challenge for next year because you're going to continue to find a percentage of families that don't have access.
Okay. Let's see. Any other questions from our audience? Okay. I don't see any coming through right now. So with that, I'd just like to say thank you for those of you that participated. This is some great information on some of the best practices and the guidelines that these type of industry and businesses should be following. You know, thank you for joining us today. We're here to help spread the word that all Meridian businesses should open in a safe and responsible way, and we want to keep Meridian healthy and open for business. Be sure to fill out your follow-up survey and give us that feedback. Have a wonderful week and keep Meridian healthy and open for business. Thank you all.
Thank you for having me.